Hello, everyone. I'm Dr. Hansa Gupta, and I'll be taking you on a very important topic related to heart, which is one of our vital organs. Dr. Chetna, thank you so much for giving me this opportunity to educate people on this important subject. Now, let me first take you through the various cardiac symptoms which guide us how to think of you're suffering from a cardiac disease. So these are the 5 important symptoms which one should know about. The first and foremost is chest pain. Chest pain, we all know, is the most common and most important symptom. Today, I shall be dealing all this in details in my talk. Next is shortness of breath. People may also complain of shortness of breath, and that may come on walking, that may come on climbing stairs or any kind of exertion. They may not necessarily be having chest pain, but they may have shortness of breath. So this is also considered as angina equivalent, meaning some people don't have chest pain, they only have shortness of breath. So that is also considered as equivalent to chest pain and is given equal importance. Next is palpitation. We all know, we generally call it as racing of our heart. In this, you may become aware of your heart beating. It may beat very fast. You may say your pulse rate is high, your heart rate is high. So this is also one of the symptoms. Next is swelling. Swelling is also one of the symptoms which indicate heart disease. Mostly swelling starts from feet, and so any swelling on the feet should be taken seriously and should be reported. Next is person can become unconscious, which we call in our language as syncope. You must have heard about this term being used by the doctors, or a fainting episode. We'll talk about it subsequently. However, you must have noticed that suddenly people get unconscious in the market, in the parks, anywhere, like while they're exerting, or maybe after having food. This is all of a sudden. So this also indicates, although this may indicate many other diseases, but there is a cluster of symptoms which the doctor will interpret. So your effort should be to report this to the doctor so that he can evaluate and find out that what was the reason of your unconsciousness. So these were the few symptoms, and now I'll be taking you through the chest pain. So let's understand what are the different types of chest pains. So people get worried, that all the chest pains are heart pains. But yes, this is important. You know why it is important? It is important because cardiac illnesses are life-threatening. Hence, it is very essential that we understand them, we report them, and you can do only this when you can do all this only when you understand that what is a cardiac kind of chest pain and what is a non-cardiac chest pain. Okay, so coming to the cardiac chest pains, let me first tell you that heart is also supplied by its own arteries. Okay, you will be astonished that heart is full of blood, yet it is demanding blood. How is that? So heart also has 3 coronary arteries. What are coronary arteries? They are the arteries which supply blood to the heart. Okay, so when these arteries become narrowed or become blocked, they are the reasons of heart attack or angina. That's what doctor says need to be opened up. Okay, so generally the cardiac pains are because of the blockage. They may also be because of the infections of the heart muscles or the layers of the heart, which are less common. You may not need to know that, because those are not all that life threatening. So what is more important is we understand that when to reach the doctor immediately. Okay, so now coming to the non-cardiac pains, which is also important for you to know so that you don't panic. Most importantly, which we come across is a muscular chest pain. You come to the doctor and you may have accustomed strains have been taken up, unaccustomed exercises, undue cold exposures, or some kind of heavy lifting of the objects. So this may give rise to your chest pain, which is muscular in origin, meaning the muscles are overstretched and they are giving you the pain. So one can, try, if the pain is not all that severe, one can always try to, do some hot fermentation, apply Volini gel, or take some safe painkillers, not the, painkillers like paracetamol or Disprin, and you can assess that is the pain going or not. Okay, so if the pain is not going, report to the doctor. Next is acidity or indigestion, wherein excessive gas formation or acid eructations can also give rise to chest pain. So we all know, we should keep some antacids, some gels like Digene, Gelusil at home, so that these won't interfere, or they won't deteriorate the heart pains. Okay, so one can always, before reaching or before getting an ECG done, we can always try with these small things at home to distinguish that is it a cardiac pain or is it an acidity pain. Chest pain can also happen due to the lung infections like pneumonia. Okay, and of course we all know about spondylitis. This is because of the bone abnormalities of the neck, spine, in fact. Okay, so these pains not only are restricted to the neck, but they may also radiate to the upper part of your chest, maybe right or left, and to both the shoulders. So this also mimics with your cardiac pain. So again, as I told you, in muscular pains, we can try with some hot fermentation, Volini gel, some safe painkillers, and you may try to differentiate that is the pain becoming better or not, right? So this is something about knowing about the different types of pains. Not all pains are cardiac pains, but yes, cardiac pain is important to know. So coming to the location of the chest pain, it is generally a confusion that people think that only left-sided chest pains are the pain due to heart. So it's very essential that we understand that the heart pains can present at different areas of the body. Okay, so I'll show a pictorial depiction of where all you can get your chest pain. So in this picture, the most common site is the left side of the chest, shoulder, and left arm. You can see this. Let me put the cursor. And so these are the areas which are most commonly involved or represent chest pains, cardiac chest pains. Okay, but there are other areas. After the left-sided chest pain, this is the central area. Where is my cursor? Huh? So this is the central chest pain. Okay, this is also very, very common. The person complains of a retrosternal burning. Retrosternal means this is your breastbone. Behind this area, you complain of severe burning rising from the stomach till your neck. So this is also a very, very common complaint that, doctor, I'm walking and I get this kind of pain. So is it acidity? Okay, so I'll tell you how to commonly differentiate these pains. Then apart from this, you can also have pain in your neck. throat suffocation, throat choking, throat pain. Pain goes, pain disappears at rest. Okay, so this is a typical choking which a person complains. Then, yeah, also your lower jaws. Okay, the lower jaws pain is coming. Patient complains. There's no other symptom but just a jaw pain. This should also not be missed. Should be kept in mind that yes, if this pain is related to any kind of exertion, should be given attention. Now comes the right-sided chest pain. Right-sided chest pain, although is not very common, but yes, it does happen and should not be ignored. In the given scenario means, having risk factors or the intensity of the pain or the associated symptoms, your doctor will evaluate this right-sided chest pain is what. Okay. Now let's talk about the severity of the chest pain. Now, why is it important? Because the severity can tell you that is it an evolving heart attack? If it is an evolving heart attack, we must understand and never forget this, that time is muscle in heart attacks. Meaning, you can save your cardiac muscle, means heart muscle, by quickly responding to your warning symptoms and reaching the hospital and getting an immediate treatment. Treatment meaning opening up your blocked arteries so that the blood is restored to the compromised muscle, right? So understanding about the pain, because this is a pain which no one can forget, no one can miss, except in few cases wherein the pain may mimic indigestion. You may just have vomitings and upper abdominal pains, means stomach pains, wherein you may dismiss it as a indigestion, right? So a pain which is very excruciating, intolerable, meaning, you are getting a fear of impending doom, you must take it as a cardiac pain and report the emergency at the earliest. Now comes angina. What is angina? Angina is a pain which is called as cry of the heart, that comes when the arteries are blocked less than 100%, meaning they are not completely closed, but they may be blocked in the range of somewhere around 70% to 99%. So because when the heart arteries are 100% blocked, they will give rise to heart attacks, and which is life threatening. Okay, so angina is basically a warning that now your arteries are narrowing down. Take care of it, pay attention to it, and get it treated, right? So that it does not lead to a heart attack. So those people who are lucky get angina. Those who are unlucky get heart attacks. But you still, in this era wherein there is a lot of progress in the treatment strategies, and a lot of, hospitals have come up with advanced treatments, feel fortunate and reach the hospitals at the earliest, so that this heart attack also doesn't turn detrimental for you, right? So we understand from this slide that a very, very severe pain is heart attack due to 100% blockage, okay, in the arteries which supply blood to the heart, whereas angina is something before a heart attack. Okay, the arteries are gradually narrowing down, and so they're less than 100%. Okay, but at some point of time, it's important to understand that this is angina, and because, this may eventually lead to 100% if we do not take care of it. And to mention here, one more important thing is your angina may gradually become unstable. Okay, what is unstable angina? This is just a situation just before the heart attack. Okay, so here here the frequency of your chest pains, the interval in which it is coming, means the exercise duration when it is coming. I'll give you an example. While you're walking in a park, suppose you're getting chest pain or some chest discomfort or shoulder arm discomfort at 300 meters. Okay. And after a few months, it starts coming at 200 meters, starts coming at 100 meters. So this is where, like, this is where we say that your blockades are progressing faster. And this is the time when you should immediately intervene, go to the doctor, and get yourself treated. Because this is the situation called as unstable angina. And sometimes it may start coming at rest also. Doctors give you Severity, you're relieved, and you forget about it. But no, see, this has a very high propensity of converting into a heart attack. So do not ignore such kind of pains. Always take care that we have to see the doctor. Now, these are two pictures which are depicting the severity of the chest pain. Now, this is very, very clear from this that this is a pain which is terrible. Okay. And this can't be acidity. This can't be muscular pain. This can only be a blockade in the complete blockade in the heart, leading to a heart attack, and should not be missed. Okay. Okay. Now I'm talking about the associated symptoms of chest pain. Means the person will not just have chest pain. He may have shortness of breath, as I have already mentioned earlier. He may have cold sweat. You would say it's a perspiration, excessive sweating. He's just becoming pale and cold and clammy. Okay, you can appreciate that very clearly. And some people undergo near fainting. They may feel dizzy, lightheaded. So and also some people may have nausea and vomiting. That's where the whole picture gets confused. If it is just a chest pain with nausea, vomiting, we generally have a tendency to deny that this is a heart problem, and we are more comfortable accepting it as a indigestion, the stomach problem. Okay, because we don't want to accept that we have heart problems. So this care should be taken, that if these symptoms are associated, it points more towards cardiac pain. Now, I will tell you how can you identify that your pain is angina and not a non-cardiac pain. Okay, because this keeps happening. Okay, we don't need to panic. We need to basically understand that, yes, what kind of pain it is. If you're unable to, or if you're confused, if you're unable, you can always see your doctor. But in the first instance, at home, you can think, okay, is my pain a cardiac pain or a non-cardiac pain? So just to revise again, let us understand that angina was actually happening because of less than 100% block in your arteries. It is basically a cry of heart to tell you that your heart arteries are getting narrowed down. Okay, so that is why the pain here is not all that severe. It usually comes on exertion. You're climbing stairs, you're going in the park, walking, or you're going to the market, taking loads of goods in your bags, and you're lifting that bag and you start getting pain, and you suddenly feel uncomfortable. You sit down. Okay, and once you sit down, within few minutes your pain will subside. Okay, so this coming on exertion and going back at rest is something which is a pointer towards cardiac pain. And I would also like to just tell you one more thing, that pains which are pinpoint, meaning you're saying, doctor, I'm having a pain here. Okay, when you are able to pinpoint a place, usually it is not a cardiac pain. Usually small pricks, doctor, pricks here and there, I'm getting pricks here and there. No, these are generally not cardiac pains, generally associated with acidity, gas, or some kind of muscle stretch. Okay, but yes, if such kind of pains are also coming again and again and are disturbing, we must get them evaluated. Okay, so generally cardiac pains are like this. There's it's a big area involved, a big discomfort, a very unusual discomfort which we don't come across. Okay, so so this is angina. And one more thing I would like to mention here is that sometimes people also get chest pains after meals, which is very important to recognize. Once they're over with the food, they start having discomfort either in the abdomen, either in the chest, and some kind of unusual discomfort is there. So this should not be ignored. Of course, this can be acidity or indigestion. We can try with antacids or molecules like rabeprazole, pantoprazole, which are commonly available over the counter. You can try with pudin hara or any churan, antacids, etc. But if it is not going, you must also keep in your mind that can it be because of the heart? Okay, so report your doctor if your acidities are not helping you. Acidity drugs are not helping, right? And generally, we as doctors, sometimes, if you're not ready to get yourself evaluated or get yourself tested, we ask you to take a sublingual sorbitrate. Sublingual meaning putting it under the tongue for a faster absorption. So this medicine sorbitrate, all of you must be knowing about it. This will give you an immediate relief within few minutes. Okay, relief coming after 30 minutes is of no good. Okay, but you are having pain, you have taken sorbitrate, it is giving you relief within few minutes, meaning within 5 minutes of your intake, is pointing towards a cardiac pain, is pointing towards it. Okay, this should be taken seriously, that now it is time that you should get yourself evaluated, right? Now, how to identify that this is a chest pain due to heart attack? Heart attack meaning now your artery is 100% blocked. Okay, and it is an emergency, because if we don't open the artery, the muscle of that area is going to die for certain. So as I have said, time is muscle in heart attacks. Earlier you reach the hospital, good is for you. Okay, you can get a treatment in time. Even though if you open the artery and the muscles are dead, it will be of no good. So reach the hospital at the earliest, identify your pain, that what is this pain? If you are not able to identify, how will you think of reaching emergency? So that's what is the reason behind telling you that these pains are cardiac pains, heart attack pains. Okay, so as I have shown you the slide earlier, the pains are excruciating. It's a heaviness in the chest. Okay, coming on extraordinary physical exertion, or usually they come at rest. Usually they are lasting for more than 30 minutes. You're doing nothing, still the pain is not subsiding. Okay, and of course the most important thing, they also do come after a very unusual mental agitation. Now, how mental agitation? Just excuse me. Mental agitation means you had a fight with your spouse, you had some property fights. Okay, you're falling into an heated argument with your relative, with your neighbor on some car parking, right? So these things happen on a daily basis. You are already harboring a disease inside you, and this has worsened, and you get a heart attack. Now, how this happens, I'll show you in subsequent videos, wherein there is a small kind of eruption in the arteries, which are called as plaques. You must have heard. And these plaques, when you fight, or when you are mentally agitated, when you are emotionally disturbed, acutely, intensely, it is then these plaques suddenly rupture. They rupture, and the blood deposits over them, and the narrowed arteries are then completely blocked. Okay, so these are very common situations which we come across in the OPDs, in the emergencies, wherein patients they land up in heart attacks with nothing, like just a tiff, just a big fight happened between husband and wife, and the person gets a heart attack, right? So and this is very clear cut pains, squeezing in the arms, shoulders, extreme uneasiness, nausea, vomiting, and he may also lose consciousness. I'll now run some videos to make you explain that this how does this plaque, the thing which I'm saying, you have heard that the cholesterol deposits, where does it deposit? Okay, and how does it work? Cholesterol deposits, where does it deposit? Okay, and how does it work? So here's an artery. Okay, you can see now this yellow thing which is coming up is what is called as plaque. Thing which is coming up is called as plaque. So this area is narrowed down. I'll show it again. This area is narrowed down. I'll show it again. Show it again. I'll show you another one. I'll show you another one. I'm sorry, there's some problem with the audio. Problem with the audio. See, these are the red blood cells. See, these are the red blood cells. There's some problem, I think, with the video. I'll show it to you again because this will help you in the understanding of the pathophysiology of heart attack. Okay, these yellow thing which you are able to see here are the plaques. There's some problem, I think, with the video. The pathophysiology of the artery is narrowed down. Okay, these yellow things which you are able to see here are the plaques.